Good evening, everyone. I'm Fred Gaffney, the president of the Columbia Montour Chamber of Commerce. We want to thank all of you for joining us, and hopefully by now you have a nice hot cup of tea or hot chocolate to warm you up after a day of digging out. The Chamber of Commerce represents over 420 businesses and other organizations from the Columbia and Montour County region. And this evening, you're going to be hearing from some of our members in business, childcare, nonprofit organizations, and healthcare about how the COVID-19 crisis has been affecting them, how they've been dealing with it, and how we all need to work together to help our area get through this and begin to recover. The recent news has been mixed. New daily case counts have definitely put even more of a strain on our healthcare system and led to the governor further restricting some business activities until at least January the 4th. But in positive news, vaccine distribution has begun. So there is light at the end of the long tunnel. And we'll talk a little bit about the vaccine distribution this evening. The community leaders with us this evening will discuss these issues and answer your questions. If you have a question, you can click on the Q&A button on Zoom as opposed to the chat button. So again, click on that Q&A button and type in your question. We'll respond to some directly in the chat, and others will be presenting to our panelists. I'd like to thank John Grabowski, the Senior Director of Community Relations with Geisinger, and his team for their efforts with this evening's program, as well as all of our panel members for their time. I'll introduce them now and ask them to offer just a few minutes about how the pandemic has impacted their organizations and again, how they're dealing with it. We'll start with Dr. Holly Morrison. She is the president and CEO of the Community Giving Foundation, which was formerly the Central Susquehanna Community Foundation. And we work with the foundation on a number of initiatives to support and enhance our communities. And they're a tremendous community partner. Good evening, Holly.
Good evening, Fred. Thank you so much. I really appreciate this opportunity to join this many community partners for this forum. You know, we are faced with the harsh reality of COVID-19 and actually just learning how to live with it right now. And at this point, I don't think that there are too many of us who either don't know someone who has been affected or who is someone who is currently dealing with it as we are airing this forum. As many of you have come to dislike the term, the new normal, we have all had to adhere to some new things. And so social distancing and mask wearing and hand washing has all become second nature to us now. The foundation hosted its annual meeting on March 4th. And actually there was a gentleman there by the name of John Whitespunner of BTE, and he approached me about this pandemic, and he talked to me about COVID-19, and with such sincere concern. And I remember leaving and just kind of thinking, what is he talking about? It was a little bit in the news, but it wasn't anything like it, you know, of course it turned out to be. But and so it began. About 1 week later, the page in our story turned. I sent most of my staff home to work from home, but the foundation is considered an essential business because of our grant-making capabilities. And we are no stranger to disaster and recovery. So the reason I was asked to join in this conversation tonight was really to discuss how the Community Foundation supported the nonprofit organizations in our community. So as we began to adapt to this public health lockdown as an essential business, we resurrected the Disaster Relief Fund and we began strategizing ways to help our nonprofits. We relied on our stakeholders and our donors who generously supported our efforts, and we worked diligently with partners to provide our area nonprofits with grants. So either they would be able to continue their case management, keep their doors open, and in some cases, just the communication alone. So I'm gonna leave it at that, Fred, and maybe we'll get into some other things as we move. I can talk a little bit about the Disaster Relief Fund and our partnership with Columbia Montour County Commissioners.
Great, yes, we'll definitely get back to
Sure.
Talking not only about the grants for the nonprofits and the needs that they were facing, but get into that business grant program for the two counties as well. So thank you.
Sure thing.
Next, we have Andrew Pruden. Andrew is the owner of the Inn, Farmhouse, and Brewing Company at Turkey Hill. And the hospitality industry has obviously been significantly impacted. Once again, restaurants are closed for dine-in service until January the 4th. Andrew, thank you so much for joining us.
Great. It's great to be here. I want to thank Fred, the Chamber, and Geisinger for hosting this forum. And I have to say, I want to start off by, there's always a silver lining. Today is the first day in 35 years that I didn't have to worry about a major snowstorm crippling my business. It's already crippled. I could actually sit back and enjoy the storm. It was awesome. So that's sort of the good news, bad news thing, I guess. And also for those that are on the call, and I see there's several, I want to thank the frontline workers, everybody that's been out there supporting the community. I give them great thanks. We run a restaurant and a hotel, but there's far more people doing much better work, and we want to give our sincere thanks to them. Back when we were told to shut down back in February, once that initially hit, I had to come to the realization that I had two major concerns. One was, how am I going to reopen? The next was my financial stability. So taking the first one, how am I going to reopen? The first thing that I did is I picked two of my employees, Ross McGargle, who manages the brew pub, and Jenny Salzman, who's here at the Farmhouse and Inn. I picked those two individuals to serve as my COVID coordinators. I knew from the beginning, and just hearing what they had to say, that they were taking this incredibly serious, and I know that they wanted to make sure that they had a part in this, and that I could rely on them to kind of follow through. They were going to follow through with the information and the learning as we went along. So we named them the two co-coordinators, and that kind of created with me the COVID committee, and that's how we started to operate before we opened. And we had to look at two facets of that. One was, how are we going to deal with our employees? The second was, how are we going to deal with our guests? And the main thing, there was actually just one word that came out of it, was trust. We had to rebuild the trust in our employees, and we had to rebuild the trust in our guests to make sure that everybody was going to be comfortable. So these two folks did an amazing job of researching, getting all the information, the Chamber being a resource, the CDC being a resource. And again, I thank the Chamber for being out front and giving us as much information as they can. These two individuals worked tirelessly. We came up with a plan to present to our employees. All of our employees had to go through a learning process. They developed reading material, videos, and before they were able to come back to work, they had to pass a series of informational tests before they could join back up onto our staff. The second thing was to ensure that our guest safety was also paramount. And what we had to do there was reorganize all of our dining. We had to remove a lot of tables. We ensured that all of our tables were 6 feet apart. There was barriers. There was no bar stools. We set up sanitation departments. We had special entrances and exits so people didn't have to pass by one another. So before we were even opening the doors, we felt very confident that we could ensure our employees and our guest safety by following their guidance. And I won't say it was easy. I'm looking at it from a business point of view. They were looking at it from the COVID point of view, but we honestly worked together. We worked very hard and came to the conclusion of how we were going to open. And once we opened, we felt like we had a great product and we could move forward. And once the summer hit, I felt like things were moving along and things were sort of getting back to normal. And I'll get back to that in a minute. As far as stabilizing our financial situation, the first thing I did was I reached out to our local community bank, First Columbia. I talked to our lead lender there. I needed help reorganizing our loans. I shouldn't say reorganizing, that's a bad term in the banking business. But how they could help us maybe not have to pay for 6 months or interest-only loans. The other thing is that they allowed us to establish a large line of credit so that if we needed help, we could get the line of credit. So from a local institution, they were incredibly valuable to give me that peace of mind to move forward. Then the other piece of that was what the government was working on, the stimulus piece and the release piece. The first being the PPP, which we certainly took advantage of. We tried to do the best that we could following the rules. Again, another story, but found that very difficult to follow because of the rules kept changing and changing and changing, especially for the companies that were shut down and were limited in terms of what they could serve. We also looked into the EIDL program, took out the EIDL loan. And I have to say, probably the biggest benefit that we got in terms of relief was our county commissioners when they took the CARES Act money and gave us a grant, and that sustained us through this year. And I can't thank the commissioners enough. They were just awesome. So my hat goes out to them. And so just to kind of encapsulate where we are, we took a major hit the first 4 months. I mean, absolutely very, very little business. The summer happened and the fall. Mother Nature was phenomenal. Warm weather, great weekends, no rain. We were able to conduct business outside because we were limited to seating inside at 50%, 6 feet apart. So we were able to utilize the outside, very beneficial. And, we were back up to about 80% during that time. Then came late fall, and with the talk of the second wave, everything kind of disappeared. And it went in, for us, it went into the cold winter. And then we got hit with the Wednesday night, can't have drinks after 5 o'clock. That didn't sit very well with us. And then all of a sudden, we just had the recent shutdown of indoor dining. And again, it was a very abrupt decision. I'm not saying it's not the correct decision, but how they made these decisions so fast and so quick that it didn't give us a chance to kind of change our operation. And in terms of changing our operation, the one thing that we never did was do takeout food. Now we're very vibrant with online dining, contactless check-ins at our front desk, any sort of number of things that we can facilitate that with our guests to make them feel more comfortable. But I'll close with that. But I need to thank Ross and Jenny for their outstanding efforts. These folks have put in more time than I'm sure I'm paying them, and they have just done an amazing job to keep us focused and in line with what we're doing. So thank you for the time.
Thanks, Andrew. And there's a number of things that we'll follow up on as we go through our program this evening. And here at the Chamber, one of the primary things we've been doing since the start of the crisis is helping our members of all sizes and types try to understand what the latest guidance and orders are coming down from the state and from the CDC. And, as you heard pretty clearly from Andrew, it's ever changing and been extremely stressful on everybody, including, business people, particularly in the hospitality industry. And hope you can appreciate how diligent they have really tried to be to remain open, but do it as safely as possible for the safety of their customers and for their staff as well. So we'll get back to some of those issues this evening. But again, thank you, Andrew, for being with us. Our next person is Diana Verbeck. She is the Executive Director of Danville Child Development Center. The Chamber is part of an early learning investment committee, which meets regularly to promote the importance of quality early child education in our area and improve access for families. And the child care industry has certainly been challenged at a time when families need it most. Diana, thanks for joining us.
Hi, Fred and Andrew and Holly and Lissa and Robin and Bryce. And I feel like I'm on like the magic carpet. So see another reference, as Lissa and Holly and I were talking about earlier, to our years in the community. So good evening, and thank you to everybody for the opportunity to participate. In addition to being the Executive Director of Danville Child Development Center, I'm also the immediate past president of the Pennsylvania Child Care Association, which gives me a lot of background in terms of what is happening across the state as well as our country in terms of childcare during this critical time. Since reopening in June, just as Andrew had said, it's been a constant struggle between juggling safety measures and to keep the virus out of our programs while trying to meet the needs of our customers, which are our families who are just trying to get to work during the pandemic. Our program specifically has a large portion of Geisinger families, so we all know how important them being able to get to work and be at work on those front lines is critical for the community's health and well-being. When we opened, there was some initial fears about, bringing their kids back to group care in a group setting. And while we worked through that with many of our parents, some of the parents that have come back now are pulling their kiddos back out for a period of time because of the surge. So we've had several families that have pulled their children from the program in recent weeks. Parents are concerned about the spread of COVID in group settings, even though they desperately need childcare to get to work. At DCDC, we are following recommendations by the CDC and the Department of Health. Employees wear masks all day unless they're eating lunch. Our children 2 and up are wearing masks all day unless they're napping or eating. And they have been incredible about masking up. If you think that little ones can't do it, you're so off the mark because they are awesome. We don't allow families to enter into the buildings for drop off and pickup. We're doing health screenings at the door before employees and children are allowed in. And we're keeping the children in smaller groups with the same staff every day. And thankfully, despite having a few positive staff cases, we have not had an incident where we've had to close a classroom, a building, since we've reopened. Unfortunately, those measures do come with a cost. And the big question is how long can we keep doing all that needs to be done to keep the children and staff and their families safe from COVID? The current situation is very definitively financially unsustainable, even in the short term, whether, whatever kind of small business you are, whether you're a for-profit, a nonprofit, a restaurant, Wagner's Trophies, it's currently unsustainable. Our enrollment and the enrollment of providers around the state has not returned close to anywhere near pre-pandemic levels, which result obviously in huge losses in revenue. Most programs are operating at about 50 to 60% of pre-pandemic enrollment numbers. And then conversely, expenses have gone through the roof just for us to be able to maintain a health and safe environment that parents can feel comfortable in dropping their kids off and leaving them with us, as well as employees can feel comfortable coming to work and being around small groups of people. So, of course, much like any other small businesses, Andrew referred to it, program owners are using personal credit cards, their savings, they're refinancing their homes to stay open so parents can work. DCDC, as a nonprofit, has pretty much, we went down all those avenues that Andrew did for his business, talking to our bankers, not seeing if we could defer mortgage payments, refinancing, all that fun stuff, looking for, the small business loans, the PPPs, and of course, the generosity of the foundation and the commissioners from Montour and Columbia County. So unfortunately, between 1/3 and a half of all child care programs, including DCDC, are unsure how long we can stay open under the current environment. And we know that quality child care is an integral part of the economy. It allows parents to be productive, working citizens who contribute to the economy and help create vibrant communities. So when this is all said and done and hopefully behind us sooner rather than later, we're hoping that there'll be enough quality child care to keep the economy moving forward and our young ones thriving.
Thank you, Di. One of the most common inquiries we had after the initial phases of the crisis where businesses were allowed to reopen, as we were getting contacted from employers on a regular basis. I would say I received a call at least weekly from an employer asking what childcare options there would be for their families, their employees and their families. So it was an issue that we certainly had been talking about and spending time on, the importance and the necessity for additional quality early childhood education, child care in our region. But the crisis has really emphasized the demands for it, and you could hear the challenges that they're currently facing. So we'll get back to that as well. Right now, we want to turn to our representatives in healthcare from Geisinger. First, we have Lissa Bryan-Smith. She is the Vice President of Clinical Operations at Geisinger Medical Center. Good evening, Lissa.
Hi. Small correction: Geisinger Bloomsburg Hospital and Geisinger Woodbine. Just so the vice president at GMC doesn't get nervous. Okay. So our lives also changed with COVID significantly in healthcare. We have in healthcare been dealing with infectious diseases and viruses forever. Geisinger started back in 1915 with a typhoid epidemic and opened early to accommodate that. So that's been our history. And this, however, just was a game changer in healthcare. A year from now, I will be with Geisinger 40 years. I'm a registered nurse by background. I've been in healthcare even longer as a registered nurse, and we've never seen anything like this. And we've been through different epidemics, and the impact has been significant. We had to change how our employees live through the day, where they wear masks all the time. From the minute they get out of their car till they get into the buildings until they get back in their car again. Many of our employees are now working from home, but the frontline teams, we're in the house. We're there all day long, and we're working with patients and trying to keep people safe and trying to work with the fears of our families and the people that we work with and answering questions and hope. So that said, I cannot remember a time in healthcare when I've been more proud to be in healthcare and when I've been more proud to be a Geisinger employee, 39 years, because I think that we've done our best in an extremely difficult time. And I am so proud to share this forum today with two of our frontline heroes, an ICU nurse from Geisinger Medical Center's Neuro ICU and one of our Geisinger Bloomsburg emergency room nurses, because they're in there every day and they see it every day. I get to go back to my office and get on a meeting or get on a call. They don't get that kind of a break. So we're impacted by every group here. My whole life has been gone about to restaurants and eating out. Geisinger orders out all the time. How we get food in and how we distribute it has been changed. Childcare, Diana, that is huge for Geisinger. Nurses say, I had to resign, or I can't come to work, or this person can't work now because they don't have childcare. They have to do their child's home, and so somebody has to be at home. It's all changed. And so life is so very different for all of us. But I am just the hospital administrator. I'm just an admin person now. I get every now and then to help out where they need me. But the real heroes are the other two people on this call, Fred.
Thank you, Lissa. And we'll get right to those frontline workers. As you mentioned, two other registered nurses with Geisinger. Next, we have Bryce Fiamoncini. I hope I got that right. He is working in emergency medicine at Geisinger Bloomsburg. He's, I believe, joining us by phone this evening. Bryce, welcome.
I just want to say Bryce had a power outage due to what we are now calling snowvid at the hospital. And so I'm hoping that his technical issues, he's going to be able to join us by phone.
All right, I still see that he is on mute, so we will hopefully get back to him, but let's move to Robin Hampton. Again, another RN with Geisinger. She works in the intensive care unit at Geisinger Medical Center. Good evening, Robin. Go ahead, Robin. That was Bryce unmuting. We'll get back to Bryce in just a moment.
Good evening. My name is Robin Hampton. I am, they said, I'm a Geisinger nurse in the neuroscience ICU. I have been an ICU nurse for 6 years now with Geisinger, but I've been a Geisinger employee since 2011. I started as a nursing assistant and kind of worked my way up as I was going through nursing school. I know my personal COVID journey has started 9 months ago and it hasn't stopped yet. We are fortunate enough that some of our nurses in the ICU, between the neuroscience ICU and our sister unit, the medical surgical ICU, they have done a lot of biocontainment training with the BCU out of the Shamokin Hospital and have gone to trainings and prepared for Ebola previous to COVID-19. So when the beginning of 2019 started, and they were like, we need COVID hospital, or we need COVID units and stuff, my unit was chosen to be that unit for COVID patients. And thankfully, we had staff that was trained in the BCU that was able to help us convert our unit. We first converted 8 beds and then 24 beds, and then was able to back off to 8 beds again in the summer. But now we have converted up to 42 beds into ICU COVID beds. We went through a lot of hands-on first training. Those nurses that were BCU trained came in and taught the bedside nurses how to be basically biocontainment unit nurses, how to don and doff properly, how to wear the PPE to protect ourselves properly, and basically taught us how to be infectious disease nurses, which we weren't necessarily used to doing. Because when we first started, we have, I believe, 150 nurses on our staff between the neuroscience and the medical surgical ICU. And when this first started, we asked for volunteers of nurses who would be willing to take care of the COVID patients. And I was one of the first nurses to volunteer between the 2 units to become a site manager training and to take care of these patients. And I can personally count on one hand how many patients I've taken care of since, I believe, February that have not been COVID patients. And these are not trying to scare anyone, but these are the sickest of the sick patients that I've seen in my 6 years in the ICU. A very common practice that we're doing right now is we are doing what's called proning our patients. And that's where we have to paralyze and sedate our patients so that we can take away the patient's work of breathing and allow a ventilator to do it for them because their body can't breathe on its own. And then we take that patient and we turn them on their stomach to allow their lungs to expand more. Before this year, I could count on one hand how many prone patients I took care of in the ICU. Whenever we had an ARDS patient from the flu, because we would see them every now and then, and ARDS is basically an inflammatory response in your lungs. We would see maybe 2 or 3 during the flu season that needed to be prone because of the flu. So it was always this big ordeal. We had everyone in the unit come to help prone this patient. So I went from seeing that maybe once a year because of how many nurses and stuff we have to the unit to when I worked on the floor 2 days ago, we had, of our 22-ish COVID patients, we were proning 7 to 8 patients on one day. So we went from seeing a treatment option that we see once in a blue moon to being a daily occurrence and doing it multiple times to the same patient. And we have gone to basically asking for volunteers of the nurses who can take care of these patients to now everyone has to take care of them because we have so many patients. So our daily life has changed on the unit itself. We went from taking care of stroke patients and septic patients and just a different variety of all different types of patients to taking care of COVID patients. And not only is it just COVID, but it's affecting their lungs, their heart, their kidneys. I could go on and talk for hours about all the different experiences these poor patients are going through. And then the trauma it's having to not only the patients, but to the families that aren't allowed to visit, and how we're busy. And even though we're busy, we're trying to set up time that these families can FaceTime their patients, or their patients can FaceTime their family members and find out ways that they can talk to them, because they are isolated, not only from their families, but we try to cluster our care so that we can save as much PPE as possible. So when we go into the room, we're in there for a half hour to 45 minutes at the time. And now I personally take a little minute to sit there and hold their hand and talk to them and how you doing today, talk about the weather, and just try to remind them that they're not by themselves, because it's very isolating for the patients. And we're very worried about taking this stuff home to our family. Geisinger has thankfully given us hospital scrubs that we can wear. So when we come into work in a day, a typical day for me is I come in, I change into hospital scrubs, I go get my assignment, I work a 12-hour shift taking care of patients in full PPE and not taking my masks off unless I'm eating or drinking. And sometimes we don't even get full half-hour breaks. It's, oh, let me go eat real quick in the kitchen because we have 3 patients we need to prone, or we have 4 patients we need to prone and supine and take care of. So we are taking turns running and grabbing drinks and eating foods and stuff like that. But we do that for 12 hours. And then at the end of my 12-hour shift, I go back, I change my clothes, I come home. Before I touch or see anyone, thankfully, I live alone, so I don't have to worry about giving it to my parents or my children or my family members. But I have 2 little kittens that love to jump on me, and I have to, I started to come into my basement so I can run upstairs, change, shower quick before I touch them and stuff like that, because I don't want to risk getting them sick or anything like that, because we don't really know how it affects animals or anything like that. But I know, I have friends that work on the unit that have children that haven't really played or hugged with their children in months because they're afraid of getting them sick and stuff like that. So not only is it affecting us at work, it's affecting us at home too, because we're with these patients hours upon hours upon hours of a day, the sickest patients I've ever seen. And then we have to be afraid of what are we taking home to our loved ones. I know I have a sister who lives in Delaware, and I haven't seen her for months because she has small children and stuff like that. And we're just afraid of giving her anything. And I just want to thank everyone that's in this call today too, because not only are we being affected in the hospital, but the economy and the people around us are being affected too. And it just completely breaks my heart that we're all having to go through this. And I appreciate, and I just want you all to know that my heart goes out to everyone. People always say that the healthcare workers are frontline and stuff like that too, but I honestly believe everyone in the community is a frontline too, because we're all a team. And no one can do this by themselves, and it's a team effort. So the community, the healthcare workers, the businesses, we all just have to work together and be a team and think of one another in this time and not just think about ourselves.
Thank you, Robin. That's the main point of this evening's program that we'll certainly reinforce as we go. So thank you for that. Before we move back to Bryce, just one follow-up question. You mentioned that you have 42 beds available right now. And if I heard you correctly, you have about 22 patients. Is that correct?
Yes. So between the neuroscience and the medical surgical ICU, we have converted both units that the individual rooms can be converted into negative pressure rooms. So we have 42 ICU beds on those 2 units that can be converted to take care of COVID patients. And I don't want to speak for other parts of the hospital, but I know another part of our ICU group, the cardiac ICU floors, they also have negative pressure rooms too, but I don't want to speak to their numbers because I'm not sure off the top of my head because I don't work over on that unit. But since this fall, the second surge, during the first part of the surge, we only ever had to have 24 rooms converted, and we never filled all 24 rooms. We had on average about 10 patients, I think, that we had as COVID patients, but now we've basically almost doubled our numbers of negative pressure rooms. And sometimes I go in and I see the assignment sheet and there's 5 patients that aren't COVID patients. And so we've had anywhere from 15 to patients in the 20s. And we've had ventilators where I think we've had up to 20 vented patients in one day that are COVID patients. So that doesn't include the other patients in our hospitals that have heart problems or sepsis, or they're sick with non-COVID issues. These are just our COVID patients.
Right. Thank you. We have another follow-up question, but I want to give Bryce an opportunity. We believe he's got his audio situation figured out. Bryce, can you unmute and join us? No, maybe not. All right, we'll give him just a second, but we did have another follow-up question for you, Robin. Again, if you do have a question for any of our panelists this evening, please type them into the Q&A section. So click on that Q&A button at the bottom of your Zoom screen and feel free to type those in. So Robin, follow-up question for you. Are all COVID diagnoses done by a COVID test, or are some done by symptoms only?
All of our patients are done by the COVID test. They have to meet a certain criteria to be tested. It's a screen that like all the employees do every morning. We ask them a set of questions, or if they have symptoms, we set off a test, which is just like a nasal pharyngeal swab where we take a swab and insert it through the nose and we swab around there. It kind of feels like you're getting your brain tickled a little bit because that's how deep we have to go back into the nose. And then we send that off for testing. And if we have patients if that comes back positive, we know they're a COVID patient, and we treat them like a COVID patient. If we have any suspicion that a patient's COVID, we treat them like a COVID patient. We put them in the negative pressure room. If that test comes back negative, but we think they have COVID symptoms, we will send off more tests called a tracheal aspirate, where this is if a patient is ventilated, we will suction secretions out of their lungs, and we will send that test off to be tested too. So we have a couple different types of tests that we use to make sure if patients are positive, and to double check them as well if we think that for some reason we got a false positive or a false negative. But to answer the question, all of our COVID patients, if they are positive in the Geisinger system, have a positive COVID test. We don't just assume, oh, this patient has COVID based off symptoms. We all have a positive test.
So that leads us into another area that I wanted to touch on, and I think we'll hand this one off to Lissa as it relates to general testing. With the Wolf administration implementing additional guidelines for testing for people that travel in and out of the state, another common question we've gotten, especially as we got into the holiday season with Thanksgiving, is, where can I get a test so that an employee or someone coming into my facility can get back to work as quickly as possible? I know it's been another important issue for education and childcare. Someone's been in contact, they want to know as soon as possible whether or not they're safe to go back to work, because every person is vital in all of these positions. So Lissa, can you talk a little bit about Geisinger's testing strategy? And then we have some additional details to share about where folks might be able to get tested.
So Geisinger has, from the very beginning, with our testing, we've required that people be symptomatic, whether it's our own employees or it's our patients or people calling in to our COVID hotline. And our COVID hotline has just been extremely important to educate the people in the community. And I know that's been a challenge, Fred. So I know people say, I just want to get tested. I just want to know. But we've stayed to the symptoms because the testing agents aren't that easy to get. So so we really are very, very careful that we just test people who are symptomatic, including our own staff. And so we follow that quite closely. And frequently the hotline will recommend that you can go other places. So I have a personal friend who he gets tested every 2 weeks. He goes to Rite Aid because Rite Aid doesn't require you to have symptoms. But it's for that kind of reason that we don't want to, that Geisinger will just only do symptom. And so whenever we see other testing sites open, because those lines have increased, and the Bloomsburg Hospital has a testing center on the Light Street Road side of our campus, and it's extremely busy. It's very busy, and it's been busier since the travel restrictions. But we are now working on some self-testing that we will be able to, some employees are going to be able to call ahead. You go in, you get the test, you'll go back to your car, you'll swab yourself, and then you go back in again. If that does well with our employees, I think we're going to keep rolling that forward. That'll help with testing. And we also have some great community partners. We have really amazing county commissioners, both in Columbia and Montour County, who have really worked hard to try to figure out how to help us out. And when I say us, I just don't mean healthcare. I mean everybody on this call, all the businesses. And they've been very creative, and they've been able to do some testing sites. Early on at the fairgrounds was at Bloomsburg Fairgrounds. I know that I think starting tomorrow morning at 9 a.m. at Montour DeLong, their fairgrounds, Montour County, will have testing. The wonderful team out at Lowe's Road, Susquehanna Valley Medical Associates, have stepped up with the county. Columbia county commissioners have partnered with that team, Dr. Williams's group out at Lowe's Road, and they're doing testing. So we're pretty lucky that we have this community that works together to get the testing out. But no matter what we open up, it just never seems to be enough. There's just more people and more people and more people that want or need to get tested for their work or their job, or they've been exposed to someone. And we all feel that pain of our employees getting exposed and a colleague go down. And when I hear Robin talk about, and I know this happens in Bloomsburg, but when your colleague goes down sick, that team takes a big hit, and there just aren't other people that can step up and go in there and prone that patient, because that is an unbelievable skill set, and to watch those ventilators. And so it's been a challenge. That said, Fred, I do have Bryce calling me on cell phone, so we can put him on speaker if you want, and we can try it that way.
Okay, we'll do that in just a second. I just wanted to follow up on the testing. Again, Lissa mentioned the testing that the Columbia County Commissioners have made available out at Susquehanna Valley Medical Specialties on Lowe's Road, and also the State Health Department testing at the Montour DeLong Fairgrounds that starts tomorrow. That's for a limited time. That's tomorrow through Tuesday from 9 to 6. Very important distinction with the testing at Susquehanna Valley Medical. You do have to be exhibiting symptoms as well, and call ahead for an appointment. It is a rapid test. It's a 15-minute test. The test that's going to be done by the health department in Montour County, you do not have to be showing symptoms, but it does take longer to get the test results back. They're saying anywhere from 2 to 7 days. So details on both of those testing opportunities is available on the Chamber's website, ColumbiaMontourChamber.com. We have that information listed on our homepage. Just scroll down a little bit and it's there. And then the State Health Department does expect to be doing additional testing for that limited window of time sometime later on this winter. They believe it will be in February. Now, the testing at Susquehanna Valley Medical is expected to hold out based upon current utilization through sometime in January. So there will be that testing opportunity there, that testing resource. And then hopefully the State Health Department will be doing that rapid, or the testing as well. It won't be rapid testing, but they'll be coming back to Columbia County, presumably at the fairgrounds, but stay tuned for details on that. So just wanted to provide that information. And again, that's all on the Chamber's website, ColumbiaMontourChamber.com. And I wanted to talk about, the importance of that testing and keeping people back in the workplace. We'll get back to Di and Andrew here in just a couple of minutes, but we do want to give Bryce the opportunity to join us. So can you try to get Bryce in, Lissa?
All right, Bryce, go ahead. Boy, this is the most technology I'll be doing in a while. Can you hear Bryce? Bryce, go ahead.
All right. So
Wait, are you able to hear Bryce?
Not quite. Is your speaker on?
Go ahead, Bryce.
good. Am I good now?
That's better. Yep.
All right. So my name is Bryce. I've been a nurse now for about 2.5 years altogether, working in the Bloomsburg Emergency Department, and worked there for about 4 total years between a nursing assistant and a registered nurse. Our lives from COVID have changed in a drastic way, as everyone else has highlighted. We're a very small hospital. We only have 12 beds, plus we have 6 hallway beds, and when we're in disaster mode, when we need to fill them up. And all of our staff members and patients this has had a major effect on us. We've had to redo our emergency room, our assignments. We used to only have 1 negative pressure room, and now we have 6 negative pressure rooms to help with the COVID patients that are coming in on a daily basis. Our staff members are stressed. Our patients are stressed when they're coming in because they can't see their family members. There's no visitors at all besides if they're altered mental status or other certain circumstances. We are actually seeing lately, we're discharging 1 COVID patient, potential or a person under investigation, and we're getting another one right through the door. So that room is being cleaned immediately by EBS, or we're scrubbing it down and then we're putting another patient right into that room. We are taking proper precautions in our emergency department, where all staff members are in proper PPE. We're wearing our gloves and our N95 and our gowns, as well as some of us are in a PAPR. I know myself, I could spend 6 hours in a day in a PAPR. I go from room to room to room, wiping it down, changing my gloves and gown in between each patient there, but just wiping it down with the Oxyverita dispatch wipes. And it's just very stressful in a given situation. When we have a patient on a ventilator in our emergency room, it's very stressful because we're trying to keep that patient in a sedated manner there, and then manage them so that their oxygen level is staying up. Our respiratory therapists are right in the room with us. It's usually 1 to 2 nurses in there, and we're limiting the amount of people in and out of that room. When a code occurs, we make sure that every person has protective equipment on, and that no one can enter the room without those proper protective equipment. Every employee is masked, and we try to social distance to the best of our ability. And when we take our breaks, if we get one in a given day, we will sit in a break room, only 1 person at a time. We'll wear our masks and our eyewear if someone else is in the break room with us, if someone else comes in to use the restroom or anything. So we're all feeling the effect of COVID just like everyone else in the world is. But the biggest message is everyone is working great as a team. Everyone comes together, and the staff members are stepping up. When somebody calls out sick because of either being tested for COVID or tested positive already for COVID-19, our employees are stepping up and picking up the overtime without even being asked. Somebody's volunteering to stay, or somebody's putting out phone calls for somebody to come in, and the majority of the time somebody is right there, and our staff members are all working great as a team. At Bloomsburg being such a small hospital, our med-surg unit has actually capped some of the days, so we're not used to holding patients. That's a new thing for us within like the past 3 months. So we're trying to take care of emergency medicine patients as well as inpatients. So we just balance our assignments out. We rotate and take turns who's taking care of the admitted patients, who takes turns of the emergency room patients, and we balance the care, and we all work together as a team. So that's the biggest message to put out there. I think that teamwork is essential in this era of this pandemic. Thank you.
Thanks, Bryce. And that leads us into a follow-up question. back to Robin that was asked. He touched on the ability to care for COVID patients and non-COVID patients. Robin, how are you able to handle that in the ICU?
So right now in the ICU, if our COVID numbers are lower, we're able to take our normal population patients. But when we're full of COVID, our stroke patients, our surgical patients, our medical patients, they're being overflowed into the other units, the other ICU units. So the trauma unit, the surgical unit, the CVICU unit, the cardiac unit, they're taking our overflow patients. So not only is the medical and neuroscience ICU taking care of the COVID patients, we have nurses who are normally used to only taking care of cardiac patients, taking care of stroke patients because they're taking our overflow patients. Our trauma surgical units are taking our overflow patients, and we've actually converted beds in our PACU because we've decreased our elective surgeries and the number of surgeries we're doing because we just don't have the bed availability to put these patient post-op. So we're actually using our pre-surgical and our post-surgical units to take care of inpatients for ICU patients and also medical surgical patients, because we have, I believe, thinking off the top of my head, 3 or 4 med surg floors that have been converted into COVID patient rooms. So our same day surgery has been converted into taking care of medical surgical patients. So our PACU nurses, like Bryce said, it's such a teamwork. And like Lissa said, I'm so proud to be a Geisinger nurse and to be part of this family because they've really stepped up. So nurses that aren't used to taking care of inpatients, they're taking care of inpatient nurses. The trauma teams, everyone is doing so great. And like our CICU, they even offered, like, because we've been taking care of these patients for the last 9 months without really getting a break, they've reached out to us and said, hey, if you need a break, let us know. We'll come switch sides with you. You come over to take care of some non-COVID patients, we'll give you a break and we'll take care of some COVID patients. We get little like baskets of, we're thinking of you from maternity and peds and from labor and delivery and patient services. Like, we feel so supported by the rest of the units in the hospital that if we have trouble, like if there has to be a patient that needs to come into the ICU, we have what's called a triage thread through Tiger Text. And we're like, we have no beds. The other ICUs are saying, we have a bed, send the patient here. So not only is the COVID units, as we're now calling it, stepping up, our other ICUs are stepping up just as much as they are. And they're taking our slack, for lack of a better term, and really just stepping in. And we're doing everything we can to make sure that these patients are given the high quality of care and making it the best that we can. As Abigail used to say, we try to make care the best. So it's really, we take care of our patients by teamwork and really good communication between the hospitals and the different units.
Thank you, Robin.
Mm-hmm.
And both you and Bryce talked about, your team having to step up and fill in gaps. And we talked earlier about the importance of testing so that, staffs can remain, as robust as possible. I know that's something that you've reached out to me about. Talk about how, that's been a challenge for your organization.
Well, in terms of being able to access rapid tests or testing results, it's just because we have what are referred to as ratios for teachers to children. So for instance, we have to have 1 staff person for every 4 babies. For 1-year-olds, it's 1 to 5, and then it increases till you get to preschool and it's 1 to 10. So all of our classrooms have at least 2 staff in them at this point, whether or not we have the amount of kids that we need for that amount of staff. But when one of them is out, it does become difficult, especially, if we're waiting on a test result and it turns out to be negative. So that person's been out. Staff are working extra long days. It's honestly, at the end of the day, it's really no different than a hospital situation in which, there's other staff that have to pick up the slack for the people who are out, waiting for test results. So, folks are working longer days, they're under more stress. But what I will say is, despite all of that, my teachers and my support staff have been absolutely amazing in terms of just jumping in and doing what they need to do to make sure that the kids are well cared for. So, it's not an ideal situation. There's a lot of hair pulling on our end, but hopefully, sooner rather than later, things will get better and we can get back to getting test results in a timely fashion so that, staff aren't out unnecessarily. And, the kids aren't wondering where their teachers are, and we can get back to somewhat of business as usual.
And Andrew, we've seen area restaurants, shut down for a period of time because they've had contact. How have you been dealing with it?
Yeah, very similar to Di. I'd like to think that we're very precautionary in that attempt. And we recently had to close down for 5 days over at the pub. And it's not that we even have actual information. We have to go on the assumption that that individual could be COVID positive. So that has been a stressor right now, and probably more so than ever. Especially with all the contacts that we're having, contacts of a contact, so on and so forth. I honestly, listening to Robin and Bryce, I have nothing to complain about, but it is something that, if there was something, a quicker turnaround so that we could get results faster, so that in our planning, we're doing a lot of what ifs and scenarios every day here at the inn and the brew pub. When I talk about Jenny and Ross, we're on the phone every day because we're really imparting on our employees to let us know what's going on. And they will call in and say, hey, I came in contact with somebody that was positive. Okay, so if that happened, here's what we got to do. And we have timelines. We got to go back. We're looking 2-3 days back. Then we have to contact all those people, tell them that they have quarantine or test. So the testing is vital, obviously, and I'm preaching to the choir here, but if there was quick, rapid testing, it would make our business flow a lot smoother, and I would feel more comfortable because of that lag period, that 2 to 3 day after the testing happens. You're caught in that no man's land, 5 days. Right, Di? You're caught in no man's land in terms of, can you schedule somebody? Can't you schedule? They're wanting to work, they feel fine, but yet you're not comfortable having them because you don't have the results back. So there is a lot of uncomfortableness when it comes to the testing that we're referencing. And I know it's not perfect, and has nothing to do with the testing people, but if there could be a more sustained, effective testing program, that would help drastically.
So, Lissa, we don't want to get too much into the weeds on this, but can you touch on the science behind the testing? Because again, what Andrew and Di are saying are things that I've been hearing from members for weeks and months. But really, if you came in contact with somebody today who was known to be infected, getting a test tomorrow doesn't really accomplish the goal. Could you speak to that?
Yeah, right. Because again, I didn't sleep in a Holiday Inn or a Turkey, so I'll do my best on the science. The trick here is that you do not develop the disease that'll show up in the test in that time frame. So people who feel that insecurity, want that security, it's probably a false security. So there needs to be the guidance. So that's why we have the COVID hotline. That team knows what they're talking about. They can talk people through what they need for the testing. I feel Andrew's pain every single day. Robin feels it. Bryce feels it. We all are waiting for those employees to be cleared so they can come back on the team. But that science and that rigor right now is all we have. We do know, we follow this closely, that there will be, I think the testing is getting better and better, and the improvements are coming. And I think that we will soon see some self-tests arrive in some stores as they get promoted. So I think the world's changing, but right now, Fred, we have to hold for the science and follow what the COVID hotline tells us and when we need to be tested. And it is painful. It is painful to try to staff, to ask people to work overtime. Bryce and Robin both, and Andrew, we spoke to the time that you spend just trying to get an employee in to cover the shift, just trying to get people in. It is a massive amount of time. So that's still where we're at right now with the science, Fred.
Right. So I want to get back to Holly and talk about some of the other ways that, your organization and other organizations have helped to support both businesses and nonprofit organizations. And Holly, you touched on early that your foundation stepped up and activated one of its programs, but also coordinated grant programs for both businesses and nonprofits in both Columbia and Montour counties. Can you talk a little bit more about that?
Yeah, sure, I would like to. Actually, so the disaster relief, Fred, wait, let me start again. Not the disaster relief, Fred, the disaster relief fund. When we enacted that, what we knew is that these nonprofits were dealing with a lot of vulnerable populations. And so they needed access to shelter and housing and food. And so between April and June, we were able to provide a little shy of $300,000, across our region through 2 grant rounds to our nonprofits. And, when we talk about nonprofits, we forget that these nonprofits are businesses, right? So in some cases, they are crisis-oriented nonprofits, and they're dealing with case management and people who are vulnerable and need access to food and housing and shelter. And then there's these other nonprofits that had to close their doors completely, and all of their fundraising efforts came to a halt. And so they were in jeopardy of actually shutting their doors. And then there are nonprofits like Diana's, who serve this population of young children and working parents, which is so vital to our economy. So nonprofits have, very different definitions across the board. One of the best things we did for our nonprofits, honestly, came from you, Fred, when we would count on you for the up-to-date information, from the governor. He would come out at 2:30 on a Friday afternoon, and at 3:30 you had something out, and we were really appreciative of that, because it was solid information, and it became very, very critical for the nonprofits as businesses to hear. We were approached by Harry Mathias, who was chosen by Columbia County to administer their COVID-19 block grant. And so it was a match made in heaven, actually, I'll be honest. We had the capabilities with our software and our people to facilitate a rapid response to their needs with applications. And we knew that the small businesses and the nonprofits needed to have that. So the Columbia County and then Montour County followed suit. So we also partnered with them very quickly. And actually, we were kind of doing them simultaneously within 1 week of each other. I believe that the nonprofit monies through Columbia County, I believe it was $435,000. And I believe that the small businesses from Columbia Montour, I think it was $3.1 million. And we processed it really quickly. And I think there wasn't a person who wasn't appreciative. You know, we had people calling our offices, small business owners calling our offices, expressing such gratitude because they were really faced with closing their doors. And so I think I heard Andrew say it. I think I heard Diana say it. This was absolutely critical for the economy. And we were real happy to be a part of that. So, you know, it's hard for me to sit here and, you know, I listen to Robin and Bryce, and I think, you know, that's really why we're doing this. I mean, it's this health side that, you know, we talk about COVID, we act about COVID, we respond to COVID, but, you know, when I listen to them, that's, you know, that's really why we're all trying to do the efforts that we do to actually let them go to lunch every day instead of making them work through their lunches. So, you know, heroes, absolutely, Lissa, heroes. And you know, I just really was happy that we were chosen as a partner to be a part of providing monies to our nonprofits and our small businesses through the county commissioners. So thanks, Fred.
Yeah, and I would add my kudos to both sets of commissioners, both Columbia and Montour counties. They moved very quickly to develop plans. As Holly mentioned, Columbia County commissioners worked with Harry Mathias, retired superintendent at Central Columbia School District, to develop a plan. And I know Harry reached out to a lot of community stakeholders, including the chamber, to try to identify plans. Montour County commissioners actually put together work groups of stakeholders and interested parties, again, including the chamber, to talk about how to mobilize those dollars. And a significant portion of the dollars in each county went to these grant programs for nonprofit organizations and to businesses. And they were able to get the money out into circulation pretty quickly. And something that the general public may not realize is the dollars were allocated to each county by a per capita calculation. So Montour County obviously got less dollars than Columbia County. So the amount of grants that went to nonprofits and for-profits varied county by county across the state.
Sure.
So, you know, folks may be wondering why one county only did grants of a certain amount versus another amount. And then also the grant stipulations allowed tourism-oriented businesses to get additional dollars or get additional treatment. So Andrew, I know that you folks qualified under a tourism-oriented business. So, you know, you were able to apply for and receive a little bit more than some of the other traditional small businesses. And I know you said that was critical for you.
Yeah, absolutely. Fred single-handedly kept us in business this whole time. You know, I look at the state and federal. It was here local. Local saved us. It chokes me up, but you know, every time I see our commissioners, I thank them every day. And because of that, it allowed us to continue to work and keep people employed. And that was such a big difference for us. I've sent letters off to our state and federal representatives saying, why can't you do this? Why can't the state support us? Why can't the federal government support us the way that our local officials supported us? Hats off to them, Holly, your organization. And the process was fair, it was smooth, and very expeditious. I can't thank you enough. I know I wrote a letter to the editor. It was fantastic. 2 thumbs up. You guys are great. Thank you.
I could go on about a half an hour soapbox about the state and federal programs, but I'll defer to you folks to tell your stories this evening. Di, talk about how the grant program was important for your organization.
Well, we are losing tens of thousands of dollars a month just because of we have to maintain our current staffing levels or our pre-pandemic staffing levels, yet our enrollment is significantly decreased. Gloves, disinfectant, trying to purchase those things. The prices have gone through the roof. They're hard to secure. You know, and just the additional cleaning expenses that we have every day. plus the additional staffing expenses. Because when we don't allow parents to take their kids back to the classrooms or pick them up at the end of the day from their classrooms, that means we need 2 staff to, one to take the temperature in the morning, another staff person to run them back. We could do it with 1. However, parents have to get to work. So we're trying to be cognizant of their time. But those funds really just helped with the bare bones operating. Typically as a nonprofit, foundations and corporate funders, are always looking for like the next great program or project to support. But in reality, what nonprofits need are operating funds, and it's especially true right now, just to make sure that we can keep going and doing what we're doing. And, we're making sure that we are being very cautious and that parents are confident in their childcare and that our teachers are comfortable coming to work. So it made me cry when I got my check from Montour County. So poor Ken Holdren didn't know what to do with me in his office. I'm just like, but it was a joyous thing, and I was thrilled, as was my board, and very appreciative for that, plus all the additional funds that we've been able to procure through various state and local entities.
I'll get back to that funding question we have in the chat, but other than funding, Di, is there one single need that you have in the childcare industry right now?
Well, I did reply to Tom in the chat box, but again, just funds to sustain our basic operations. And outside of that, I would have to say, gloves, disinfectant, I can't tell you how much we go through a day, and much like, folks in healthcare change their gloves every time, they're dealing with a patient, we're changing gloves every time we're, changing a diaper, or we're cleaning up messes. So we're constantly going through them. And and unfortunately, and I don't think it's just, if anybody else were to order gloves, they'd probably be paying the same ridiculous price that we are. So, that doesn't really make it any easier to get. But yeah, just that. And, we really need COVID to go away. That would be the single most important thing.
It's coming. It's coming.
Oh, Lissa, I hope so.
Coming.
So just a quick follow up on that, and then I want to get back to Lissa. We touched on the vaccine, but we really haven't gotten there yet. And boy, time is going quickly. We have enough questions here for about another hour, but we want to be respectful of everyone's time. But a question was asked in the chat if there are any other funding programs available for businesses at this time. As far as grant programs, we have a link to one very small program called the PA 30-Day Fund on our website. It's for small businesses with at least 3 employees. And I forget what the top limit is, maybe 15. They offer forgivable loans, which are essentially grants of up to $3,000. So you can find information on our website. As far as grant programs beyond that, not right now. However, I was just on a call this afternoon with the U.S. Chamber of Commerce, and the next federal relief package apparently is getting very close. Congress expects to work through the weekend if they cannot get this finalized before then, which would, as of right now, include an extension of the Paycheck Protection Program. And they are also, which I just learned today, looking at extending the Employee Retention Tax Credit Program, which would also offer significant benefits for businesses and nonprofit organizations as well. So again, best thing to do is please keep an eye on our website, columbiamontourchamber.com. We're posting all of that information on a regular basis as it happens. We're updating our website almost daily. So please keep an eye on that for the latest details. And again, before we start to wrap up this evening, again, gone very quickly, I want to thank everyone for your questions. There are a couple that we may not get to. We will capture those and try to answer those offline. And again, we are recording this program, and we will make this recording available as well. So again, look to the Chamber's YouTube channel afterwards. If you know someone that may be interested in this evening's program but wasn't able to attend, if they're still digging out somewhere, we understand, but the video content will be available. So Lissa, you mentioned that we do have a light at the end of the tunnel, and it's with the vaccine, and distribution has begun. Can you give us a status update?
Well, I know that we just did a press release that the vaccine arrived in Danville, and that was huge for us. It was already in, it's been all around us, but we now have it in Danville. Jersey Shore also received it. We will be giving the vaccine to our frontline teams. We've figured out how to do it by tiers, the teams that we have to help first. We will be doing it both at Danville, and then we'll be giving the vaccine to Bloomsburg and Shamokin. We're focusing on our emergency room employees. So the Robins and the Bryces of the world, our respiratory therapists, our environmental service workers who go in there and help keep the rooms clean and safe for patients and for all of us. And so basically the frontline team. We also know that the vaccine is going to go to the nursing homes and their staffs, and that's going to be also key for our beds in the hospitals and for all of our communities and the people and how we're all together. So, get the vaccine, 21 days, you get the second vaccine. Moderna is very close to being approved by the FDA. That'll be another one because, of course, we got the vaccine today, but it's not enough for all of our employees. It's not enough to do the community. We do believe, based on what we know this coming, that we will get through everybody by the spring, and that's just keeping our fingers crossed. You tell by my hair color that I fall into an age group that's at risk, and my husband also. And I want to see us all get this, but everybody on Andrew, Diana, everybody, Holly, it's coming. Robin, Bryce, it's going to get here, and we do believe by, this late spring, we'll be in a different place. And in the meantime, though, please wear your mask. Please wear your mask. Keep us safe. Keep those people safe that work in the grocery store every day. Respect all of the team player. When you're pumping gas, wear your mask and wash your hands and do all the things that keep us safe. In the meantime, but it's coming, it's here. The science is with us. This vaccine has more efficacy than our flu vaccine does. So, we just got to get over our fears and anxieties, but I believe that it's there. But in the meantime, stay safe, stay safe, stay safe.
Thanks for that, Lissa. As we see that light at the end of the tunnel, Robin and Bryce have touched on it. And we did have Bryce on video for a little while. Hopefully we can get him back here. But wanted to ask each of you before we get into final thoughts. He is back. Okay, Bryce, we'll start with you on this one. So, Robin, you talked about, the intense schedule and teamwork that you've had to pull together. How are all of you in all of your positions, and again, we'll start with Bryce, but how are you coping day to day? How are you keeping your spirits up? How are your teams able to keep doing what you're doing? Bryce, we'll start with you.
So each morning on our huddle, actually, that we have, we just go over what the highlights of the day will be. We go over how we're going to stay safe, and we're just telling each other what a good job that we're doing each time. We're thanking each other constantly. We're telling each other what kind of great teamwork that we're having. Every time that there's a code situation, when somebody comes through the door that has a code or anything like that, we have a debriefing afterwards. And after we debrief, we tell each other what we did do right and what we did do wrong, what we could have done better. And as we're doing this, it comes together and just builds our morale each day. We try to give each other the props every time that we're working, and we just really, really tell each other, great job today, great job today. Let's continue to do this on a daily basis.
Robin?
I agree completely with Bryce. We have our safety huddles in the morning. We have an afternoon safety huddle that we just kind of, this is what we have for the day. This is our staffing. This is how many patients. This is how many open beds we have. This is how many patients we have waiting to come into the unit. So it's just everybody is open and there's like no secrets anywhere. Like if we hear something, we share it. Our managers are out in their office. We have a fabulous team between our ethics department, our chaplains, and some of our mental health staff at Geisinger. They're actually coming and doing support groups for our staff where they're coming for a couple of hours a day and they sit in one of our conference rooms. And if we need to go out and talk to them about what's going on, that's really helpful, especially because like we've been taking care of some of our own staff recently too. Like our own staff is becoming sick and becoming our patients. And that's hard to cope with and stuff like that. So having those resources is really useful. Our managers got together and turned one of the conference rooms that we would use for family meetings that we're currently not using it and turned it into a meditation room, where they put like chairs and stuff in there and music. And you can just go into that room and have complete and utter silence for 5 minutes. Because I don't know if any of you have ever gone into an IC or an ED, but they're loud. There's beepings, there's alarms, like there's never a quiet moment. Like if there's a quiet moment, you're looking over your shoulder and going, what is going to happen next? Because it's normally the calm before the storm. But just having that and having the support, and like my managers have an open door policy where like if we need to go into their office and just cry or whatever it is that we can do, we can always go to them. And then our family is like, I haven't really been able to see my family as much as I would like to, but like I have 3 older sisters, 2 of them that are actually nurses at Geisinger as well. So Geisinger is really a family for us. I get my local on my way home from work calls. Hey, how you doing? I'm calling in to check on you today. My sister that lives in Delaware, we've been Zooming and FaceTiming and stuff like that. And we just been checking in that way and just having the support of the community. And like today I was shoveling out my driveway and I went outside to do my sidewalk and my neighbor knows that I'm a nurse and he popped out and he had a snowblower and he cleared out my car for me because he's like, I figured you had to go to work soon and I didn't want you to be tired because I know you work long shifts. So just little things like that and just the support of the community, our family, our friends, our administrators. I know Dr. Rue has come by the unit multiple times. I was like, hey, how are you guys doing? What can we do to help? What do you need? If we need it, if it's within the power, Geisinger has gotten it for us, like the hospital scrubs. Knowing that we don't have to wear our scrubs, that we are in these rooms for 12, 14 hours a day taking care of patients, the fact that we don't have to take those home and take them into our house is a huge relief for us. So just those little things where people are supporting us just mean a lot.
So Lissa, it sounds like you're doing a good job with your teams, but anything to add about, from administration level, what you're doing to try to keep your teams energized and moving forward?
So, we were in the middle of all this, then, we get this thing called a snowstorm and, and what do we do? How do we keep and so we focus. So, all right. So we still have to take care of COVID. We still have our other sick patients that are coming in the hospital. And we work really hard, by the way, every day to say, it's still safe to come if you have a cardiac problem. It's still safe to come if you're have a GI problem. But what we are really spending time on is how to keep the staff that are healthy to not burn out because it's such a precious resource. We want to keep them healthy. We want to keep them safe. And I was in a room a week ago and one of the nurse leaders said on the weekend, it was the unit was extremely stressed, one of the COVID units at Danville. And the nurse leader said to the person on the weekend, here's money, just go down and get the team sugared soda because they wanted sugared soda. And the Geisinger family, we don't have available sugared Coca-Cola or Pepsi. And the team needed sugar, and they just did it. So somebody just went down, drove down to the Weiss Market, got the sugared soda, brought it back, and that's the kind of real-time decisions that makes a difference to the frontline team. You can say all the right things, but it's those really right in the minute. What do you need? Get it done. Get them a quiet room. Get something special. Round, just being there. Dr. Rue showing up at all of our campuses. The head of the system, our chief nurses rounding, and then just our locals. So the fact that I'll go down in the ED, and if they need help with the one-to-one, I'll help with it. They don't like me there a lot, I know, because it kind of breaks up the fun. But it does show that you care about your team if you show up. So I think that's what we're working really hard on, and keeping ourselves safe so that we can keep coming to work and keep doing the right thing. And we feel the community around us. That's a big deal. Bloomsburg, I'll talk about that. It's just a small hospital, but it's a small community hospital. And so we feel that team all around us. And, you made me smile when you said, Wagner's. That everybody's been there for us, whether it's the ambulance company, it's the police. I was in the emergency room last evening. And, there were our town police, and it is a community effort. And so I'm grateful to the commissioners of both Columbia and Montour County. I'm grateful for this whole family on this call, because that's what's keeping us going.
Thank you, Lissa. Holly, your team has heard about a lot of needs from a lot of organizations, hundreds of businesses, dozens of nonprofit organizations. There's never enough money to go around. How are you keeping your team motivated?
Well, I'll tell you what, you listen for every one of us. Who would have ever thought that a restaurateur would need a COVID team? You think about that, and you think about each one of us in our own venues trying to motivate our team, because I can't believe the behavioral health issues that are coming out of this. And as leaders of teams, it's incredibly important, first of all, that we take care of ourselves, but more importantly, that we are really out there for our staff. When we were virtual, I wrote them a message every morning, just a positive message. These guys talked about their huddles. We did a message every morning. But one of the things we did, before I forget, it was something that really came through at the end of the year, was something called Singing in the Rain, which is a message that our foundation is trying to spread. And it's really all about peace and love and kindness. And one of the things that we offered to our nonprofits was grant monies to really recognize that they have been faced with the most difficult year that I've experienced. Long hours, working remotely, technology challenges, right, Bryce? Technology challenges, limited budgets. So we wanted to provide a grant to increase the mental health in workplaces in our nonprofits. And so examples of that were kind of what Robin was talking about, the aromatherapy rooms and stand-up desks and some catered lunches and those kinds of things, just to say thank you. That's really what it was all about, was just to say thank you to those nonprofits. So, we want to spread a little peace and kindness and love, wear your mask, social distance, and wash your hands. And now I have to excuse myself. I'm going to work the boulevard. So
Hi, enjoy.
I get to hand out chips.
Thank you.
Be safe. And as a beneficiary of one of those grants, very much appreciated at the holidays. Our team has been, the chamber never closed either. So through our foundation, we were a fortunate recipient of some of those funds and used for some extra holiday gifts for the staff and some things that make day-to-day work a little bit better here. So thank you very much, Holly.
Very cool.
All right. Have a good night. Andrew, you talked earlier about the turmoil that you've been dealing with and constant changing and adjustment. How is your team doing?
Things were going along very well, and I have to say just recently, things have definitely become a lot more stressful. We are seeing a lot more contacts out in the community, and now with the shutdown, that kind of has mitigated some of that. So it kind of was peaking, and now with the shutdown, us not being able to have dining indoors, that's kind of mitigated some of those issues. So we're a lot fewer on campus now than we were, which is very sad. I'm incredibly hopeful that I hope the Congress gets its act together and passes some of this legislation for the workers and for the businesses as well to take care of these folks at least through the next 3 to 4 months till we get through this. I have to say, you know, the morale, I'm very surprised. Everybody has been very, very upbeat. They understand what we're going through. I do feel as though they are seeing the end of the tunnel. They see all the hard work that's being done by the individuals that we've been listening to, and they have faith in what they're doing. So I do think that we're looking at May, June, that, you know, come that time that we're going to be coming out of it. And here we've always had a strong family ethic within ourselves and taking care of one another. So there's been a lot of bonding, and that certainly has helped us through this period of time. And just reassurance that we're going to be around. I tell that to all of us. And we're not going anywhere. We're going to be here through those financial, stabilizing efforts. I can guarantee everybody that we're going to be here in 4 to 6 months. We're going to come out of this, and things are going to be positive. So I do feel as though most people feel like this is the beginning of the end, or the end of the beginning, or whatever. We're going to get through it rather quickly. So all in
I
all,
think there's a lot of people very anxious to gather around a big table with friends and family and have some drinks and good food. So we're all looking forward to it.
I hope it doesn't feel scary, because I'm not sure the first table that comes in, we're going to be like, we're desperate.
Di, what about your team? And go ahead. Di, what about your team, and what about the kids? How are they dealing through all this?
The kids are amazing. Like I said before, they come in with their masks on. They wear them like they're supposed to. They're not trading them like people were all concerned that they might be doing. You know, our teachers are fabulous. You know, we have a great work culture. We joke around a lot. You know, I've been there for 22 years, so a great number of the staff. So thankfully, you know, we're like family. Mother Nature gave us a snow day today, which was desperately needed, you know, for everybody's mental health. And, you know, I certainly hope, you know, our families took the opportunity to make the most of this opportunity for them to have time for fun and some relaxation with their children, because, you know, they're only young once. But, you know, at the end of the day, we work with children, and, you know, those hugs that they give us are, you know, and the smiles and the jokes are by far, you know, worth every stress that we have to deal with. So if it wasn't for them, you know, it's, you know, if we had to do this for widgets, it wouldn't be any fun. So thankfully we have young ones that bebop around and make it worthwhile.
So it's good that we're ending on a bright note. Any final thoughts, Di, as we wrap up?
Wear your masks so we can get over this. Please. And
Andrew?
get your vaccines.
Yeah, look at Andrew. He's
Andrew,
ready.
any final thoughts, sir?
Not too much different. Honestly, just be respectful of everybody. Keep your distance. Do the right things. there's so many people doing so much good work out there, and we need to support everybody. And that's what we're trying to do, is just be conscientious of everybody out there. We're all headed towards the same goal, and I know we're going to get there. So thank you. And I thank everybody I've learned a lot myself just listening to everybody, and thank you for that.
Thanks, Andrew. Robin, final thoughts?
Just to wear your masks, wash your hands, support local businesses, and just think of others. We're all small communities. I grew up in a small town, Mount Carmel, not too far away from Columbia County. And I know what our communities can do when our backs are against the wall. And I know how people can help out their neighbors when they really want to. And that's what we just need to do. We need to support our neighbors, support our local businesses, wear a mask, and wash your hands. And if you're sick, stay away from people.
Good addition. Bryce, final thoughts?
Agree with everyone. Wear that mask. Hand hygiene is most important there. We educate everybody on that. And if you're sick, stay home, please. And quarantine if you're being tested for the COVID. That's the biggest thing that we're asking. Please just wear your mask and do proper hand hygiene.
And Lissa.
Just want to thank again the Robins and the Bryces of the world and how brave they are, and actually everybody that I see when I go to the grocery store, every time I go out, and the restaurants that please just keep going, stay there so I can go out and eat again, because it was one of the most favorite things that I used to do in a week, and I miss it so desperately and terribly. And again, just support and stay local, and do as much as we can for our own community, and wear a mask, wear the mask appropriately up over your nose, wear the mask up over your nose. And again, I'm just really proud to have a community where so many good people are taking care of us, from our county commissioners to our nurses, everybody. We're just really blessed.
I would agree with that, Liz. I've been trying to look for silver linings throughout this entire crisis, and while we are physically separated in a lot of ways, I think it's only resulted in us appreciating each other more. Maybe we take advantage or take it for granted when we're able to get together, whenever we want to, and as we're on the Hanukkah and Christmas season, to not be able to get together with everybody that we'd like to. I think it really hits home about what all those personal connections mean, and we are small communities. And one of the great things about my job and my position at the chamber is the amount of people I get to see and interact with, and that's certainly been limited. So, we're all looking forward to a much brighter 2021. I want to thank all of the leaders who are on this evening's call, not only for taking the time to be with us, but for your ongoing efforts in your day-to-day positions across the spectrum. Business, nonprofit, healthcare. I hope everyone watching now has a greater appreciation for what you've all been dealing with, and really understand the important role that everyone plays in helping us get through this. So, as it's been said numerous times, please keep these people and their words in your thoughts. Continue to do your part by wearing your mask properly, maintain your safe distancing, wash your hands frequently, and if you're not feeling well, please isolate yourself. And with that, best wishes to all of you for a safe and enjoyable holiday season and a much brighter 2021. Have a good night.
Thank you.
Thank you.
Thank you.